Welcome to this very special season of Let's Talk Value, fully dedicated to our latest book written by a set of 5P experts in the field of healthcare change, The Next Tango, a patient guide. This is really an interesting book that also became a #1 bestseller on Amazon just recently. This season is fully sponsored by 5P Healthcare Solutions, a boutique consulting firm dedicated to transforming healthcare through value-based healthcare and multi-party collaboration. I'm Hanna Boëthius, co-editor and co-author of The Next Tango and the host of this episode. And I'm so delighted to have one of my co-authors here with me today. This is the fabulous author of Chapter 5, The Policymakers View on Supporting Patient Centricity and Care Coordination, Paul Sherrington. Hi, Paul.
Hi, Hannah. How are you?
Good, how are you? How
Yes, I'm
about
very
we
well, thank you.
start off a little bit easy and, we just take a quick introduction. Let us know who you are, Paul.
Well, so who am I? I'm a scientist by background, by training. I've spent my working life initially doing some basic research on blood cancers. I've always worked on blood cancers in various settings, so basic research in hospitals and research institutes. And more recently, I spent some time working in the pharmaceutical industry, where I gained huge amount of experience in various aspects of healthcare, including policy making and things like that. And more recently, I've become the chief executive of a small organization, but growing, which aims to accelerate the way that we deliver clinical trials for patients with blood cancers. So that's me in a nutshell. I live in Switzerland, alongside some other people I know very well.
True. Wow, that really makes you an expert. And I'm very happy and pleased that you agreed to contribute to this quite big project in the end it became. And on that note, what and why did you decide to contribute to this book?
Well, I just felt, well, when I was invited by Verena and yourself to contribute, I thought about it and I thought policy making is not my #1 area of expertise, but I have been exposed to it in various forms. And I thought this was, being a patient-focused book, this was a good way of sharing my personal experiences, both as a consumer of healthcare in two different countries with completely different healthcare systems, and from my professional experience. So, as a member of the public, as a patient, and as a healthcare professional, I guess, is what I thought I could maybe help people understand things like why healthcare policy is so highly regulated, try and put this in terms that people understand and can engage with. So it was really loosely based around that. The reason for me agreeing to contribute and enjoying the process.
That's wonderful to hear. Thank you for sharing that. That makes me feel a little bit better for putting you guys through all this work that we did. But you do highlight already one of the key points that I also wanted to highlight, which is a quote from your chapter, actually, and that is healthcare is one of the most, if not the most, regulated industry. And that is, I thought that could be an interesting point to discuss for us as well.
Yeah.
How do you think this either helps or hinders the policymaker in their work?
Well, it has to be, healthcare has to be highly regulated because we're talking about people's lives. We're trying to improve people's health, and improve outcomes for people who have got serious diseases. But of course, the way you do that is typically with drug intervention or things like transplants and other medical devices, many of which can have very serious side effects. So, of course, everything has to be very tightly regulated. And I'm sure I don't need to give the example, which probably led to the increase in regulation in all aspects of healthcare, and the thalidomide incident, is that the right word? Um, um, Back when which I remember very well as a very young child. So yes, was a terrible thing to have occurred, but the one benefit that came from it was the tight regulation and the close look at safety of patients, whether they're being treated in clinical trials or just in normal health care practice. So
No,
that's one of the reasons healthcare policy is tightly regulated, of course.
yeah, no, of course, and that is a bit self-explanatory, but also, you do sometimes wonder um, if there would be better innovations if it wasn't. It's a double-edged sword, I would say, too.
Yes.
Yeah.
But I think that what we've tried to achieve in the book is, ways in which patients can try to help themselves. And, in policy making, the patient voice is now being increasingly heard, right from early stages of drug development to the way that actually healthcare is delivered. So I think this is a very positive thing that's happened in the not so in the recent past, really.
Yeah, because it hasn't always been a clear point that the patient voice should be heard or it should be taken into account. And this, of course, I
Mm.
say with my very sturdy, very biased
Yes,
patient advocacy hat on. But it has been in the past very difficult for patient groups, patient advocacy groups, all these things, all these stakeholders in terms of patients to get their voice heard as well. So I'm happy to see that this is changing, and this is also why I'm so happy that you were able to contribute to the book in this sort of spirit of that
yep.
patient's involvement, that it is crucial in a
Yes,
patient-centric healthcare system, and that should technically go without saying, but
yeah.
it hasn't been so clear. So I'm happy that we could clarify this once and for all in the
Yes,
book as
and
well.
this is something I see in my everyday working life now more and more. And our organization are really actively making sure that we try to hear the patient perspective and not just from volunteer patients. We're actively going out to look for patients from different socio-economic and different racial groups, just to make sure that everyone's voice is really heard.
And I think that's very crucial, and that's a crucial point to patient engagement and patient advocacy and involving the patient, because the sort of tokenism in patient advocacy and just inviting the one patient and speak to them for however long, and then not really keeping them in the loop and not feeding back what actually happened after that interaction, or so just so that when patient the patient voice becomes a checkbox activity in whatever
Yeah,
it is, if it is drug development or policy or whatever. I think that is almost more dangerous than not
yeah,
involving the patient at all.
yeah, quite right. I think it's fair to say that when you look for volunteer patient uh, advisors, that's a fairly self-selecting group. It's often tends to be fairly well educated, fairly well off, and typically white people
Mm.
for whatever reason. Now, there's nothing wrong with their opinions. We need their opinions just the same as everyone else's.
Yeah.
But, I do think it's necessary to try and expand the net so that we do capture opinions from these other groups that I mentioned before, different ethnicities and people from different socioeconomic backgrounds.
No, that's a very valid point, and I think this is something that needs to be. I mean, great that we, have gotten to step one, that patients are getting involved in everything, but this is almost the next step and needs to be taken quite soon in order to avoid the checkbox activity slash tokenism.
Yeah.
And I think the more diverse, and I know this is a highly debated choice of words in some parts of the world right now, but the more diverse the patient population that you can talk to, the better, because you get more insights and you get more experiences that you might not get from this one or two
Yes.
chosen patients in that way. And this is also something that I get to hear in a lot of my other advocacy work, that, well, you're not a normal patient. I'm like, thank you very much. I know I'm not a normal patient. I have taken it upon myself to be educated in my condition, and even in the clinical part of it, and
Yeah.
the care route of it. And but it's interesting what you say, that we should really focus on more diversity in the patient
Yeah.
populations, because that's also true. And whether it then is policy making or drug development, and everything in between.
Yes. And I think this is now translating into the more widely acceptable use of real world data,
Yeah.
real world evidence, which is now being adopted by some of the regulatory agencies to help with policy frameworks. It's becoming more acceptable, rightly so, and more important.
Yeah, absolutely, and I couldn't agree more with that. And I'm happy to see this develop. But yeah, I'm not a very patient person, although I am very much a patient. But I would like to see more and quicker.
Yeah.
But
Yes.
change
Yeah.
always takes time, and
Yeah.
especially in healthcare, when you're dealing with such difficult to change course ships that are giant and have been going the same way for years, and then you're trying
Yeah.
to make them change just 1 degree of their course. And yeah, it's
Yeah.
not easy, and it's going to take time, so I will have
Yes.
to just take a
But
deep breath
at
and
least we're making a start.
exactly, yes, we're making a start. And um the power of a small group of people who try to create change shouldn't be underestimated. I read somewhere in a fantastic book that I recently have read 500 times.
Very good.
Anyway, moving then along to in 10 years' time, how do you think we will engage with the other P's then?
So that's a really interesting question. And who can predict the future? And, technology and things are advancing so quickly these days. But I would like to think that there's a kind of seamless engagement between all of the P's, the 5 P's, such that they work together in a very productive, easy way in order to make significant advances in the practice of healthcare delivery, development of new treatments, etc. And I guess the use of artificial intelligence in some form or another is highly likely to be part of that, and part of making this whole engagement fairly seamless between all of those different stakeholders, including patients, of course, as one of them.
Yeah, Yeah, absolutely. And I think you're absolutely right. And I think that's a very realistic view of how we can start. Of course, no one can predict it. This is why this is such an interesting question to, and
Yeah,
especially to ask to so many diverse people to see what they answer. And this is, I think your version of it is very realistic. And I think we are definitely, hopefully, at least getting there within the 10 years. But
yeah,
who knows? As you said, we can't really predict it. So we will have to just wait and see. But yeah, I think we are also in for quite an interesting future when it comes to healthcare. After having, navigated the seas, if we bring back that, analogy, for in the same way for so long. And I think
yeah,
through all these advancements that we're making currently and through technology and the potential of AI and all of these things,
yes,
it could be very interesting, at least if you look, at it a bit more objectively, maybe than I should be doing, being
yeah,
a heavy consumer of healthcare. But yeah, I think you're absolutely right. And I hope you're right, because
yeah.
if we keep doing the same, we can't start expecting different results, can we?
No, but yeah, you're absolutely right. Change is good. And whatever, it will be interesting to see how this all develops. But let's hope it goes in the right way.
Yes, absolutely. So
But we can all be
one, yeah,
part of helping to guide that.
yes, absolutely. And this is also why we wrote the book,
Yeah,
to also show a little bit that while there are many stakeholders within healthcare, and I mean, Verena has been talking about this for years with 5P, but to show that there is a way, if we have a common goal, if we have a common vision for what we see is needed in healthcare, then it, like it says in another chapter, it doesn't have to be difficult. It
yeah,
it can be
absolutely.
really, you just make a lean version of it first and then sort of build onto it.
Yeah,
And I think that's what's so fascinating, that somehow it feels like all these stakeholders, to a certain extent, including patients, including, everyone else, but have made it a little more complicated than it maybe has to be.
yes, absolutely. Couldn't
Yeah.
agree more. Yeah.
One more quote from your brilliant chapter, Paul, and then we will wrap up. And I promise I'll let you get on with your day. But I found this discrepancy in the following quote so interesting, that the quote goes that regulators require the most narrowly described patient population, while the payer requires a real world body of data that the new pill can actually work in the entire population with the disease in a particular country.
Yes.
And, and this is so interesting to me. And this is part of, it's a bit of an eye opener in terms of a quote, to really see it black on white, that the regulators need one thing. And then in order to get it paid, they need something to see something different.
Yeah.
And technically, in my, I guess, slightly naive, simplistic mind, they should really be working, both these stakeholders should be working towards the same goal with the
Yes.
same set of data.
Yep. I agree. But of course, when you're developing a new treatment, um, you have to do that within the confines of a clinical trial. And it's really important that the people included in that clinical trial are homogeneous with respect to their diagnosis. Um, and that currently is the only way that regulators will accept data from those trials, to be that they can then assess and decide whether or not the particular treatment in question should be allowed to be marketed.
Yeah.
But then, of course, these days we can define diseases so accurately with the new technologies like genomics and various proteomics, other diagnostic tools that we have at hand, that you can really finely tune the 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 homogeneous nature of that
Yeah.
population that you're testing. But then, of course, you don't, that's not real world. And that's partly
Yeah.
where, I mentioned real world data and why that's becoming so important. And it probably is more important to payers at the moment than it is to regulators, but I think that will change a bit. Um, so yes, you move from a very well-defined patient to the general population of people that may have the same disease,
Yeah.
but with subtle differences which made certain patients ineligible for those highly controlled, closely monitored clinical trials. So it's a question of how do we navigate that? Because if you, it would not be possible if you define patients who fall under one heading, let's say acute myeloid leukemia. You can take that group of patients and define them genetically very precisely. But then you would have to run a clinical trial for dozens and dozens of separate groups of patients, whereas we can broadly group patients into different, we can risk stratify them, we can treat them according to their intrinsic fitness and ability to withstand different types of treatment. But yeah, clinical trials have to be very well defined in terms of the patient
Yeah.
population you're treated, but then you do want those treatments to be applicable to wider groups, and hence this disparity between
Yeah.
regulatory approvals and healthcare reimbursement.
Yeah, and I really agree with you here, and I really love the cartoon that you have in your chapter. So this is figure 5.1, and how to exactly what you just described, how to, manage this bureaucracy and then bodies of regulations, even within clinical research, and sort of how to make it real and
Yeah.
to get that into regular care. And I think that is really such a brilliant point to make in this very important chapter that you wrote for the Next Tango.
Okay.
So thank you so much for sharing your very valuable insights, Paul, and being part of our Dream co-author team. We are very grateful to you.
Oh, thank you. It was a pleasure.
If you are curious to learn more about how 5P Healthcare Solutions can support you as neutral brokers in your journey to healthcare transformation, let us know how we can aid in bridging diverse interests among the 5P providers, pharma, patients, payers, and policy. Thank you so much, Paul.
Thank you, Hanna.